Hypertrophic cardiomyopathy is an autosomal dominant disorder with 50% involvement of first-degree relatives, though the extent of involvement is variable. The hallmark of the disorder is severe hypertrophy of the left ventricle, even though biventricular forms may be rarely seen. In the obstructive variety of hypertrophic cardiomyopathy, known in short as HOCM, asymmetric hypertrophy of the interventricular septum compared to the posterior wall is the predominant feature. The hypertrophied septum impinges on the left ventricular outflow tract, producing obstruction. Diastolic frame of echocardiography in parasternal long axis view in hypertrophic cardiomyopathy, demonstrating the thickened interventricular septum, which is disproportionate to the thickness of the left ventricular posterior wall. The echo density of the IVS is also varying with a speckled appearance. The anterior mitral leaflet is in open position and aortic valve is in a closed position, indicating diastole. The left atrium is dilated. Compared with the size of the aorta, usually both are roughly equal in this view. Color Doppler evaluation in the parasternal long axis view in hypertrophic cardiomyopathy, illustrating the mitral diastolic flow. The mitral flow is not turbulent as indicated by the blue color, without any variance or mosaic formation. The AML is seen in the open position and aortic valve in closed position, suggesting diastolic frame. Early systolic frame in echocardiography in hypertrophic cardiomyopathy. Early systolic frame shows that the aortic valve is open but the left ventricular outflow tract is wide and the AML is in the closed position. This frame is just before the onset of the systolic anterior motion or SAM of the mitral valve. In the eject, obstruct, leak sequence of dynamic LVOT obstruction, this is the initial eject phase. Color flow mapping in early systole in hypertrophic cardiomyopathy. Color Doppler imaging in early systole in HCM shows that the flow in LVOT is not turbulent, that is red color without any mosaic or variance. This corresponds to the eject phase of the eject, obstruct, leak sequence. The blue color behind the mitral valve is possibly a slight backflow during the closing of the valve. Echocardiographic frame later in systole demonstrating the SAM of the mitral valve. This is due to suction effect of the LVOT ejection, that is Venturi effect. SAM causes further narrowing of the LVOT in addition to the obstruction caused by the hypertrophied septum jutting into the LVOT. Abnormal orientation of the papillary muscle and the consequent pull can also contribute to this SAM. SAM septal contact